Advantages of using hypnotherapy in cancer settings.
Gary, one question on that. I think it's a really important point. So when someone phones you up and says, I've got breast cancer, whatever, can you help me? How do you answer that question?
I'll say, the first thing is, how would you like help? What would you like help with? And again, I'm very patient-led with cancer, because I get a lot of people say to me, oh, I've got a friend who's got cancer, what can I do to help them? And the first question I say is, ask them, what would they like help with? But with somebody like a breast cancer patient, I say, what would you like help with? Is it pain control? Is it the anxiety going through the journey? And stuff like that. And if they say, well, is there anything you can do for the cancer itself? I'll say, no, we cannot. We're not legally allowed to. Theoretically, there is nothing we can do. But I do say to people that there is experimental things that we can do to augment your treatment, not in place of it. So when we come on to PNI, for example, there is work there to show that mind techniques and emotions can change the makeup of the immune system. So therefore, there are things that we can do with that, which you may say is a little bit of a dodgy ground, because theoretically we are then working indirectly with the cancer. But as long as you say it's experimental and it's to augment what you're doing, and we're not working with the cancer as such, then you can do that. Okay. So some of the advantages you get: costs, and you reduce costs. If we can get a fast recovery, then we're reducing costs. They're in hospital beds for less time, so that's pretty useful. We can have less stress for both the patient and the staff. I mean, if, for example, if we're dealing with phobias, side effects, and management of medication and stuff, we can have less stress for staff, we can have less stress for the patients. Pain control. One of the things that I found in my research that I'll come on later is medication can potentially be more effective. That's the indication. Is pain, for example. When I did my research, the patients that underwent pre-surgical hypnosis, and it wasn't something we looked at, we were looking at the psychological aspects, but as a side thing we looked at pain perception with them, and we found that the people that underwent the pre-surgical hypnosis considered that they were feeling less pain when we actually followed it up. And when we sort of delved down, not only were they perceiving less pain, but they were actually taking less pain medication than the control group. So therefore it gave an indication that it's possibly more effective. Obviously they've got their psychological well-being, because we can get them, sort of give them coping mechanisms and so on. And of course there's more bed space available. If you're getting people sort of a better throughput, medication's working better, then get them out. So it's saving money, freeing bed space, so it's good for everybody. I mean, further advantages, it's safe. Generally, well, as long as it's done right, you don't produce any adverse side effects. Something I alluded on when we were doing the induction to start with. For a lot of patients, it's the only me time they get. It's the only time they get to relax. They're going through this journey, they're panicking, they're stressed. Quite often I'll see people on the day they come in for their chemotherapy or their radiotherapy, and it's while they're sitting around waiting for the treatment to happen. And that's about the only time of all the running around they'll get to sort of have the attention of somebody to relax them. So it's me time for them. There's no side effects. It can give them a temporary, or sometimes even better, respite from some of the symptoms. You can help them feel more empowered, more in control, and you can teach them self-hypnosis.